Hi everyone, Eileen Bayer the Fam here. Welcome to the second installment on my mini-series on bipolar disorder. In case you missed yesterday we just went over a introduction on what bipolar disorder is. And in that introduction I did let you know that there was two different types of bipolar, type 1 and type 2. Type 1 being the more severe and type 2 the less severe. In today's installment we're going to cover some of the causes of bipolar disorder, and and just to let you know before I begin, it's going to talk as far as the genetic aspect of it. It will be covering some issues with the brain, which in this illustration you can see right here, this is a normal brain. And on the right here you can see this is a brain with that has, from somebody with bipolar disorder, on how it's distorted. So it does affect a lot of the brain, and we will be covering a little bit of it. I'm not going to go into all the areas that it affects because I'm not a medical doctor, so I'm not even going to try to say all the medical terms, but we will be touching base on it. So saying that, let's get started. The cause of bipolar disorder likely varies between individuals, and the exact mechanism underlying the disorder remains unclear at this time, although genetic influences are believed to account for 60 to 80% of those at risk at developing bipolar disorder, indicating a strong heredity component to this. The overall ability of bipolar syndrome has been estimated at 0.71%. But studies have shown that identical twins will have a 40% chance of them both having bipolar. Now, what that's saying, before I go further, it's not saying that if you have identical twins, they're going to have bipolar. It's saying genetically, if there is bipolarism in your family, if somebody in your family, aunts, uncles, grandparents, great-grandparents, parents, sisters or brothers, something like that, somewhere in the genes, and you have a set of identical twins, there's a 40% chance that both twins can get bipolar disorder. Okay? Compared to 5% with fraternal twins that have the genetic inheritance. There has been some studies that show that the estrogen in women can be linked to bipolar disorder. Now, this hasn't been completely proven, and it is not saying that all females are going to have bipolar just because we have estrogen. That's like saying all men with testosterone are going to have a mental disorder. That's not what they're saying. It's just certain things, and none of this, it's like autism. There's studies, but there's not enough evidence to prove any of this. There is, the cause of bipolarism, besides being hereditary, is just not enough there. There's not enough evidence to link anything completely. The risk of bipolar disorder is nearly tenfold higher in first-degree relatives of those affected with bipolar disorder. And what this is saying is, like I said, if you have somebody in your immediate family, sisters, mother, father, aunts, uncles, grandparents, great-grandparents, somewhere's up that line. First generation, like probably, let's just say your mom had bipolar. Your risk is 10 times greater than somebody that their parents did not have bipolar. That's what that is saying. I want to make these points clear as we go along so you understand what it's saying, and you don't get the wrong understanding of it. It is probable that relevant life events and interpersonal relationships contribute to the onset and recurrence of bipolar mood episodes. And what it's saying is, basically, it can come on as a child. We'll cover that in our next segment on when bipolar comes in. But what this is generally saying to you is your life events does have some effect on it. There's an old saying, it's not the storms you go through it's how you handle them that matters. If you have a lot of stress in your life, you could end up with bipolar if you don't handle your stress appropriately. And that's why it's always important that when you think you have a problem, you talk to somebody, you reach out. If you feel you need medical attention, whether it's physically or mentally, you do it, because stress factors deal a lot with what goes on with our body. Okay, studies have shown that at least 50% of adults diagnosed with bipolar disorder report traumatic abusive experiences in childhood. I don't know how true that is. I don't have anybody that I know of that I've actually am close enough to ask them what their childhood was that has bipolar. But the studies have shown that abusive children, whether it's verbally abusive, physically, or mentally abusive, that suffered long-term abuse end up with bipolar, and that's what that is saying. And you know, abuse is a horrible thing. No matter what it is, it causes deaths, it causes a lot. But that's not the issue that we're discussing today. But you can see how what they're talking about with life events, how it affects us. If somebody's raised negatively, told as growing up, they're never going to amount to nothing, they're stupid and all this, all their life growing up, they're going to believe this. And it does affect them mentally, physically, and emotionally. And this is what it's saying, is your life events has a lot to determine. You, as a child, you know, it's really hard to talk about. I mean, my childhood, I loved my childhood. I come from a large family of 7 children. I'm the youngest, but I have a very loving father and a very loving mother. My mother has passed, but my dad's still alive, and I am thankful for them. But unfortunately, we're not all blessed with that. There are some families that have abusive dads or abusive moms, or both of them are in alcohol and drugs or something. So they have more of a chance to get things like bipolar disorder because of their bad relationship, you know, that they had growing up as a child. Okay, and they said that it is associated with earlier onsets, a higher rate of suicide attempts, and more co-occurring disorders like PTSD, which is so true. The number reported of stressful events in childhood is higher in those in adult diagnosis of bipolar spectrum disorder compared to those without, particularly events stemming from harsh environmental rather than from the child's own behavior. Okay, now less commonly known is the neurological aspect of bipolar disorder, and what I mean by that is the neurological causes of it, which this is the area I'm just going to kind of skim over a little bit because there's a lot of medical terms, but it basically talks about the brain, and like I said earlier, you can see the difference from a normal brain to a brain in bipolar disorder. So you can see there is a big difference in what they're talking about. Okay. Like disorder may occur as a result of or in association with a neurological condition or injury. Conditions like these injuries may include stroke, traumatic brain injury, HIV infection, MS, hysteria, and rarely temporal lobe epilepsy. They're not saying any of these things have to do with bipolar disorder. They're saying there is a slight chance, but none of that has been proven. The physiological contributions to bipolar disorder can be from abnormalities in the structure and or function of certain brain circuits and could underline bipolar disorder. Studies have shown decreased volume in the left rostral lateral part of the brain, and increases have been reported in the volume of the lateral ventricles of the amygdala, as well as in the rates of deep white matter. And what they're talking about is this here, the difference here. Like this here is yellow here, and here it's red. Where it should be yellow, you see there's the red, and how this is distorted here, and you don't have a lot of green like you do here. And this is what they're basically saying to you, is how it affects the brain. The brain patterns of a normal person is clear, and you can see that in this picture here, how clear it is and stuff. But yet the brain of somebody that has bipolar disorder, this is what it looks like. A totally different picture. So you can see it's not that people with bipolar disorder are trying to act differently. They have no control because it's in the brain. That's why it's a mental disorder. It's not physically. It's up here in the brain, and there's nothing that can actually fix it. Medication can help control it, but it cannot correct it completely. Manic and depressive episodes tend to be characterized by verbal versus dorsal dysfunctional in the ventral prefrontal cortex. In brief, that's just saying that the MRI studies on people with bipolar disorders has found the effects on the different parts of the brain, which is what I have right here. This is a normal brain with no bipolar disorder, and you see a lot of yellow, blue, green, and the red, but they're in the appropriate areas. And in this section over here is a brain with somebody that has bipolar disorder, and you can clearly see this is red instead of yellow. This blue is totally distorted. There's not a lot of green. Like here, there's hardly any green. You have a lot more red here. See how we only have like 2 reds here? and you have very bright reds here, and how the blue, how that's distorted, and this, and that's basically what it's saying. A person with bipolar disorder, their brain does not function like our brain does. But they're still a human being. It's just that something happened in their brain at a certain age for certain reasons, which we will cover tomorrow. We will go over when you can start noticing bipolar disorders and then go into some of the symptoms of it. Okay? Excuse me. But this shows you the difference between a normal brain and a brain in bipolar disorder. There's a big difference. Now, with medication, the brain will look somewhat like our brain, but not completely, because it does not, it helps regulate things a little bit better, but it does not 100% solve the problem, because it's something that they're going to have for the rest of their life. You know, the medication is not a band-aid. It's to help control the bipolar disorder so that they don't go into their manic episodes from their highs to their lows. And we'll go over the different type of treatments in a later session of this anyway. But that's it for today. But before we go, I want you to remember this. In order to see with your heart and not your eyes, you have to remember to be kind to everyone, not to be quick to judge. See from the inside out, not outside in. Okay, and remember, you matter to me. You out there, yes, you. You're important to me. You matter to me. Okay? We're all uniquely made. And we're made to where we need one another. And I don't mean that in any way that somebody wouldn't take it wrong. The way we were created was we were just created to need other people in our life. And that's why that song is One is the Loneliest Number, because it is. When you're by yourself, it's very lonely. It's like being in a dark, dark tunnel and not knowing where to go. Okay, so remember, be kind to one another, show love to one another. Most of all, think before we speak. See with the heart and not the eyes, because you don't know what that person's gone through in their life. You don't know what they're going through. You don't know what's going on in their life at this moment. Most of us communicate through social media. Some of us live across the world. We don't know what that other person's going through in their life. We're not here to judge. It's not our place. Our place is to love each other, to uplift and encourage and inspire. That's what we were put on this earth to do. So you matter to me. You're important. And remember, I love you with all my heart. So until tomorrow, bye. Love you.